I'm Dr. Harlan Pollack, and you're watching the Plastic Surgery Channel.
Tattoo removal is another commonly performed procedure in plastic surgery offices, and we're seeing more and more of it now that tattoos are becoming such a popular thing in our culture. Very often people will have tattoos done in their teenage years or early 20s, and suddenly life changes and they become, older adults, and they get into their 30s, or their environment changes, and now instead of at school they're in a business environment, and that tattoo that seemed like a good idea when they were 20 doesn't seem like such a good idea when they're 30. The technology for tattoo removal has really been around for quite a while, and the general idea is that when you have a tattoo, ink is placed in the skin. The body looks at that ink as a foreign body and it tries to get rid of it. And there are cells in the body called macrophages, and these macrophages are little cleaner cells that will gradually break down the ink and cause that tattoo to fade over time. And this is a naturally occurring process, but it's a very slow process that literally takes decades to occur. When we treat a tattoo with a laser, what the laser does is it breaks down the ink into smaller globules. So instead of having a large rock, you have lots of pebbles. The cells can then go in and clear out those pebbles, so you'll see a very rapid clearing of the tattoo. Now, when we see rapid, we're talking about clearing over months or a couple of years versus decades. So these are patients that require a series of treatments, and usually we'll see 6 or 8 treatments over a period of a year to a year and a half, so the treatments will usually be spaced every 6 to 8 weeks. But it allows you to literally erase a tattoo. Now there's some variations in effectiveness. Certainly patients that have lighter skin are going to be less likely to have complications from these treatments. The complications being scarring, changes in skin pigmentation, changes in skin texture. The darker your skin is, the more natural pigment you have in your skin. And if you have more natural pigment, then the light that's being used with the laser will tend to have a greater effect on your skin and therefore result in more problems. But for the vast majority of patients, they can literally have these tattoos disappear and be unrecognizable over a period of time with very, very little change or almost no change to their skin. Now, there are different types of lasers that are used. The most commonly used type of laser is called a Q-switch YAG laser. And this has been around for a long time, and essentially it targets the pigment. Now, different colors will also respond differently. Black is going to respond the best because black light, by its very nature, absorbs all wavelengths of light. Now, when we have different colors, then we start getting into problems. Now, red tattoos or red ink will also typically respond very well, but it's the blues and some of the greens that are the most difficult to treat. There's some improvement in treating blues and greens when we use what's called a Q-switched Alexandrite laser, but when we use that type of laser, then it loses some of the effectiveness on the reds. So the type of laser that one uses to some degree is going to be dictated by the type of a tattoo that a patient will present with. But I think the vast majority of practices that are treating tattoos are using the Q-switch YAG laser because it's the most versatile and really has the best results and is the most effective.